Hi everyone, today we are going to discuss about 4 pillars of dentistry. You can call them as steps as well, because without executing step number 1, you won't be able to execute step number 4. I have been discussing about this for years, so let me tell you what they are. Step number 1 is diagnosis, step number 2 is treatment planning, step number 3 is communication, and step number 4 is execution of skills. As you can see in this diagram, communication is overarching all 4 steps, and that's because you need communication while you're executing any of these 4 steps. So let's look at them a little bit more in detail. Diagnosis. When patients come to see you for examination or an assessment, if you haven't been able to diagnose what they have, if they have any issues, then the steps will not go any further. Patient will go home and they think that they have healthy mouth, and you won't be able to generate treatment. So make sure that your diagnostic skills are up to scratch. Of course, you don't want to overdiagnose, and you need to be mindful of not over-treating treatment. However, in my experience, patients are very under-treated whenever I'm seeing any referral. So make sure that you're taking your time in diagnosing any issues. For some reason, if you have a very short checkup appointment, make sure you're calling those patients back when you think that the patient needs much more thorough assessment. Once you diagnose the issue, then you can move on to step 2, which is treatment planning. Now, treatment planning is really important, even if you're not going to execute those treatments. So let's say an example. If a patient comes to see you for a crown which has caries underneath, and that tooth needs root canal treatment, and the angulation of root is such that you do not feel comfortable in doing root canal treatment, and you're going to refer that patient to a specialist. However, you need to make sure that you remove the crown, remove caries, assess the tooth for restorability, and then refer patient to endodontist. Otherwise, there is no point in doing root canal treatment for the tooth which you cannot restore. So you need to be able to make sure you plan the treatment, even if you're not going to execute the treatment, and you plan the stages. I always tell dentists that you need to, when you're not being able to provide the treatment, when you're just doing treatment planning, you need to treat yourself as a conductor of orchestra. So you are really guiding everyone what you want to do, but you are the one who are really in charge of the show. So make sure your patient feels that way. And what will happen is, when you start treatment planning more and more cases, you will then start taking some of the aspect of those bigger treatment plans. So if you're doing full mouth reconstruction, you may start with learning about Michigan splint, start doing Michigan splint, start learning occlusal concepts, and refer your cases to someone who can do full mouth reconstruction. But then once they finish, you can then execute and do Michigan splint. So make sure that you are being involved in the treatment plan. Once you have carried out treatment plan, then the third step, and most under evaluated step, is communication. We've spent much less money in learning about communication than learning about step number 4, which is execution of skills. So make sure you brush up on your communication skills. You can invite your colleague to observe you while you're doing talking to patient, while you're proposing treatment plan, and ask them for an opinion as to how did you do. If you're recording your consultations, then go over and over those consultations again and listen to yourself, which is really cringeworthy. But make sure that you listen to yourself and try and pick out any mistakes you've done in order to improve your communication skills. I feel that that is the best way to learn communication skills. By calling in someone else who is, you think, better than you, and giving a feedback. Even if that person is not better than you, any dentist will be able to come in and, as a third person, may be able to pick out more mistakes than you can pick out by yourself. And number 4 is execution of skills. Now, we all are really good at this. We'll do all the courses to learn how to do treatment, how to carry out amazing class 4, bonding, or even full mouth reconstruction. So I have no bones to pick in this area. I feel all the dentists are really good at concentrating into improving their execution skills. However, you will not be able to reach this stage until you have done for number 1, 2, and 3 steps of this process. Now, communication is overarching the whole 4 steps, and that is very important. So if you are, let's say, diagnosing an issue, you need to be able to communicate or relate to patient why you're taking time, why you're taking photographs, why you're taking radiographs, why you are checking pocketing, why you're probing around their gums, because none of the patient likes it. So you need to be able to communicate very well with patient what you are doing. When you are planning treatment plan, your communication skills needs to be good, because you need to understand patient very well and what they want. Because once you reach at a stage where you can almost execute anything, there is no treatment you cannot do, the challenge is that not what is an ideal for that patient, but what that patient could have, considering the circumstances, their age, their financial circumstances, their traveling commitments, their work commitments. There are different things you need to really understand. So communication skills helps in planning, treatment planning, and execution. While you're executing treatment, then you need to be able to explain to patient what you're doing and why you're doing it. One of the example is when I am, let's say, removing amalgam from the cracked tooth, I would take photographs at each stages. So I would take photograph pre-op, I would take photograph mid-treatment, which means removal of the amalgam and assessing the crack. So before removing caries, I'll take a photograph. I'll take a photograph after I've removed caries. I'll take a photograph after I've done a build-up, and I'll take a post-treatment photograph. And I'll show this to patient, because then patient understands why you're doing what you're doing. And if you do this, you will have less complaints from patients that I've been mistreated, I've been overtreated, because photographs don't lie. And when you show this to patient that, look, I've removed the old filling and there was quite a lot of decay, I've removed that decay, now it's closed to nerve, and that's why you may need a root canal treatment if tooth becomes symptomatic. So communication is fundamental during the whole 4 steps. So I hope you enjoyed this presentation. After listening to this, I would like to give you 3 tips which you can implement straight into your practice. So tip number 1 is concentrate on your diagnostic skills. Now, one way to avoid missing anything is make a list of treatments. So make a list of, scaling and polishing perio treatment, or whitening, ortho, onlays, check about cracking teeth, and put that into your template. And make sure while you're doing examination, you have assessed patient for each and every treatment or each and every modalities of treatment of what you can offer to patient. So make a list of those treatment and check against that. And that's how you won't forget to treat patients. Because I've seen many times dentists, in one practice, one dentist is doing lots of Invisalign, whitening, onlays, whereas the other dentist is not being able to do that many treatment. And this is surprising, because the patient cohort is same, the practice is same. So how come one dentist is doing so many treatment and the other dentist is not being able to do that treatment? And many times it is underdiagnosis. Tip number 2 is make sure you brush up on your communication skills. Do the courses, do online courses. There are lots of good courses available. Brush up on your communication skills and ask someone to come and visit you. Your colleague, it could be someone who you work with, and just ask them as a third person. You can even ask your nurses. You don't even need to call someone else. And after you finish consultation, ask your nurse, how did I do? What mistakes I did. And you would be surprised. They just don't tell you because they might feel that, they are not in a position to advise you. But if you give them power, they will be able to help you in improving your skills. And the third thing is take longer time into planning and taking photographs and documenting your cases. And at the end of the treatment, showing that to patient, that what you have done. That will build a really good rapport. And in future, when you recommend any treatment to patient, they will not doubt you, and you will have much higher case acceptance. So I hope you like this short video of 4 pillars of dentistry. If you have liked it, please share this video If you have any questions, please contact me on social media or go to my website and contact me through my website. Or if you have any question, drop a message below. In the next video, we are going to discuss about the question that do you really need to know about occlusion? And we will answer some questions about occlusion in the next video.